In our video today, we're going to be working on the lower, mid, and upper back. You're going to need your set of therapy balls and a block. If you know you have a lot of tenderness in your low, mid, or upper back, then you may want to swap out the therapy balls for two of the squishier 4-inch balls. And to start with, we are going to identify in the low back area. You've got your low back curve here. And if you follow your spine down, you'll feel some bony areas right about here. We're going to go right above that area. And if you feel your spine, oftentimes you'll feel a little more muscle on either side. That's where we're going to go. If you're going to use the bigger balls, you'll hold them right about here. If you're using the smaller balls, what I'd like you to do is have them in the mesh bag, but create a little space between them, about a thumb's amount of space, and then snug them up again. And then we're going to put them right here. Now, you can choose to have something to rest your head on. If you tend to have a more forward head posture and a lot of tension in your neck area, you might want to have something to put your head on. You can use your half roll, you can use a small pillow. Start with your knees bent and up. That helps you really be able to slowly and more easily modulate the pressure into the balls. So start nice and easy. Don't just lower down, put all your weight on the balls right away. So again, find that spot. I'm going to hold them there with one hand and kind of come down onto my elbow, find my other elbow, make sure they're in a nice meaty, muscly spot here. And then I'm going to work my way down, keeping some arch in my back so I don't put too much pressure down too quickly. And then again, making sure they're just in the right spot. And then slowly letting my body, the weight of my body come onto the balls. Softening the rest of my body, breathing with my belly. And if this is the first time you've tried this, be very, very patient. And again, resist rolling on the balls. We're just waiting for those balls to work their way up into the tissues. And you can choose to keep your knees up, or you can try putting your legs down and just seeing how that feels, how that changes the input into the body with the balls. I actually feel a little bit more with my knees up, so I'm going to leave them up. So you would stay here until you feel that sensation start to dissipate. And again, that dissipation feels like there's just suddenly not as much tenderness in that area. Once you feel that, then you have a couple options. One is to lift your body up and move with your hands, move the balls up 1/2 inch or 1 inch. The next option is to sort of inch your way towards your feet, and the balls will roll up the spine, either side of the spine. And then if you feel tenderness or tightness, then hang out there for a while. If you don't feel a lot, you can continue inching your way up. I'm holding on to my shirt, otherwise the shirt can sometimes get bound up in the balls. Okay, that feels like a good spot. So again, you can hang out here, you can try straightening one leg or the other or both. The other options that you have are to move your legs slowly in different directions. You can even pull a knee up, especially if you tend to have tightness on one side more than the other. This might just give you just a teeny bit more leverage to press into the balls, but again, holding, softening, and holding is what we're looking for. You can even do both. The goal is to explore, and don't take a position simply because I'm taking that position. Your job is to explore what you're feeling in your own body and what positions create the right sensations that you need. You're trying to find those tender spots in your body and release them. And everybody's body is different. Okay, I'm going to roll a little bit farther. And go ahead and roll more. Okay, just so I don't roll out of the video, I'm going to roll back up here. Slowly lean back onto my balls. Okay, I'm kind of right about the bra strap line now. And this is an area of old injury for me, so I can feel a little more tenderness here. And again, try these positions, but if they're too much, then don't stay there. And move into everything very slowly, move out very slowly. Okay, I'm gonna move up between the shoulder blades now. And once you're up between the shoulder blades, you can still play with the position of your legs and just see how that changes the input. But you're probably going to feel more variety if you start moving your arms. And crossing your arms across your body will spread your shoulder blades apart and begin pulling into the muscles and fascia that we are over now, that we're pressing into now. Okay, I'm going to move a little bit higher. Again, playing with the position, finding a position, and then softening. Okay, I'm going to go a little bit higher. So I'm kind of, you can see where the balls are. The next step in this process is finding your block and lifting your hips, putting the block will then change the angle of the balls a little bit, creating a little bit more pressure. And then find that point where you feel that tension, that mild to moderate pressure, tension, sensation, and soften and wait. And breathe. in this particular position, we have the balls paired together in the mesh bag. And we can, in this position, take the balls out and move them away from each other a little bit more. And as long as you're staying in an area where there's some density of the soft tissue and you're not directly on a bone, you can move those balls wherever you need them to be. Okay, I'm going to go ahead and take the block out, and then I'm going to rock off the balls. Be careful if you roll to one side to get off the balls. You don't want too much pressure going in. This is easier for me. Okay, so that's an easy way to go up the spine and really work along the spine and up between the shoulder blades. And there's a thick line of fascia that goes from under the feet, up the back of the legs, up the back, and then all the way around to the top of the head. So even if you're experiencing tension headaches, neck pain, working along that line can be extremely helpful. So I hope that was helpful to you all. Have a great day.